And you lock it in. See? Of course, before injecting anything, always bleed the needle. It's like basically you have a gun, you want to fill in the gun now. You inject a little bit to get rid of the dead space that's found over there. So you see that? Okay, so you got rid of the dead space, and I usually just kind of flick it off. And start closing it back in again. Alright, good. هي سياسة الشهد أشهد أن لا إله إلا الله. Okay. Alright, so if you look at this patient, she's a very lovely patient. She tells me she's 37 years old. She does not look 37. I mean, if she looks 37, then I look maybe 42, and Dr. Hassan looks 20. Okay, so she does not look 37 at all. She looks much younger than that. So 17 اسمح لي كبرتك شوي دكتور. Alright, so sit up. Okay, so usually whenever you see a patient, always ask them to sit up. Okay, and this is the area in which you want to assess your patients. Look at this patient here. Everybody's going to jump up and say, oh, she's got tear troughs. Do not inject the tear troughs first. Always try to assess whether she needs anything in the mid-cheeks. She has great skeletal structure. Okay? Her cheekbones are fantastic. This is natural, very naturally made cheekbones. Okay, so you do not want to ruin this. You want to enhance it. But what happens as we age is that our fat compartments right here in the mid-cheeks tend to atrophy. The only fat compartment in the frontal face that does not atrophy is the most medial one, okay, which is right over here. And that's why you see a lot of patients who come to you, or maybe a lot of delegates here. You see that they always have this part. This part is always there, but this part is gone. And this is the area in which you want to inject. You want to inject this part over here to bring back that youthful appearance. Okay, so this part is usually does not get atrophy with time. Okay, this part atrophies as the person gets a little bit older. So in her case, what we are going to be doing is that we are going to try to recreate this area over here. There are a number of ways that we're going to do this. You can do an HA if you like. Okay, you can in this cases like this, for example, you can use QCL Ultra Deep, or you can use something like Perlane or Sub-Q, or Juvederm Voluma, for example. You can definitely fill in that area. But I want to show you different products. So in this case, I'm going to put a calcium hydroxide, which is Radius. And dogs. There are many ways to actually achieve this response. Okay? As they say, the Americans say there's many ways to skin a cat. Okay? So one approach basically is just to come in from the sides and to fan this area up. Okay? So it's a very simple procedure. Okay? So, and this is what the procedure that I usually tend to do, is that I will come from here, I see the area of the defect, okay, and I see where my needle is, and I'm going to put my insertion right over here and treat this area going this way. And then, because I want to create a little cross-hatching, come a little bit more on the below side and treat this area over here. She'd be a perfect candidate if I had cannulas. I will definitely use a cannula in her case. Okay? But I only have the needles, so we're going to use the needles. Now, another technique that you can do is that you can just simply go in, okay, and just put in small little bolus. So you can come in and just basically inject a bolus here and a bolus there and massage the bolus. Okay, so that's another technique of doing things. Alright, so there are different techniques in which to try to achieve the exact same response. Alright, very important thing with Radius is that you want to be on the deeper side. So this is the area that she needs to be treated. What I'm going to do is that I'm going to go a little bit on the deeper side. Did you feel any pain? I said no. She didn't feel anything, which is good. And then I go in, and I'm going to show you exactly where I'm very deep. So you cannot see my needle, so I'm quite deep. Okay, I'm subdermis. You can't see the needle. Let's see. Let's play around here. So this is deep. Okay, we pull out. I want to show you something else. I'm sorry for the patience. Sorry. Okay. This is superficial. Do you see how superficial I am? Do you guys see it? Okay, so this is very superficial. She feels pain, okay, and you can see the needle that's over here. So this is, yeah, this is the superficial dermis. This is the area you do not want to inject with radius. I just did it on the patient just to show you. I'm sorry. Okay, so I know we're gonna start injecting.
Evaluation sheets is a must.
Yes, please.
أنا عايز حسن يجي لنا كل سنة بس أنا محتاج evaluation sheet عشان خاطر ما حدش يطلع من غير ما يستلم evaluation sheet. Evaluation sheet is a must, please.
Okay, I'll tell you. Alright, so guys, so remember, I just injected here. You can see my needle, the end point of my needle. I injected as I'm coming out. I'm quite deep. And then before coming out, I turn it. So I'm fanning. And then I inject again. And then I come out. And I do the exact same thing. Okay, so I kind of filled up this area very well, very well. Then I stop. Then I come out. And then re-massage the area. Should I say Hasabelan? Alright, so I injected about 0.2 right now. Very small amount of calcium hydroxylate. Very, very small amount. And the same exact area, what I'm going to do is that I'm going to come in from underneath it. I want to create that cross-hatching effect. So the same thing. Protect the globe. Remember, for radius, 3 areas not to inject. The glabella, no. Teeth troughs, no. Lips, no. Okay, so these are the 3 areas you do not want to inject radius. So remember, my injection was over here, and now I want to cross-hatch it. So I come in. There's nothing here. There's no structure whatsoever in this area. So I come in, go in deeper. I'm very deep. You can see I'm pulling the cheeks. Look how deep I am. Very pulling the cheeks. And then I'm coming out. Any questions?
Are you under the muscle?
Yes.
Sure.
Remember, the deeper you are, the more volume that you're providing in the deeper tissues. What's happening is that you're pushing the natural or normal tissues upwards, and it just has a much more natural effect in the end.
Excuse me.
Yes?
What will happen if you inject in his muscles?
Nothing. I mean, remember, the muscles here are part of the SMAS, so, nothing is usually going to happen. But if you inject superficial to them, and you inject a lot, you'll end up with nodules. Formation of these nodules, and you don't want that to happen. Okay, the question is that if they happen, what can you do? Because radius, remember, does not have an eraser. Okay, so the Juvederm, Restylane, all the hyaluronic acid, you can use hyaluronidase, they dissolve. But if you develop a nodule or a lump with radius, what can you do? You can do a number of things. One is inject saline. Okay, so injecting saline, what happens to it is that it breaks down the nodule. Okay, it's like you have, for example, you have like a stone or you have sand or mud on your shoes and you clean it, okay, by putting water, so it just breaks down, it becomes mud. Okay, so that's one way of doing it. Another way of doing it is that massaging, rigorous massaging. Okay, so I usually tell my patients to buy these vibrating toothbrushes. They vibrate. So they use that and they put the toothbrush here, they turn it on and just massages so it breaks it down. It just breaks down the calcium part, it breaks down the gel. Then that's basically, these are the two things that I would usually do. Alright, so we've injected about 0.4. I mean, she definitely needs a little bit more, so we're going to put in a little bit more closer to the mid-cheek now, so we're kind of pushing as we're moving that way. Now remember, this area has become numb because of lidocaine that we've added. Numbness? Okay, it's like going to the dentist, so it's completely fine. So we're going to treat now a little bit on the mid-cheek area right now. I usually tend to also fan from underneath. Now remember, there are a few videos of on YouTube. If you search, for example, radius and search my name, it basically explains exactly, it's like a workshop. It explains exactly how to inject it. It's on YouTube. so a total of 0.7 was injected in one cheek right now. And I'm going to ask her to sit up and we'll try to see how she's doing. Alright, do you guys see the difference between the two? No, back. Yes, they're good. Okay. No, you don't see it, they just look straight. Alright, I see when she smiles, look at the smile again. See how her cheeks kind of fill up nicely here? She still has that divot going downwards. Okay, so we filled her up right over there. Okay? So she looks very, very natural. She can go outside right now and just basically look completely normal and natural. Look at her, she's looking downwards. This area is filled up, this area is going down. Okay? So you can see there's a little difference there. Okay. Alright, very good. Time to relax. How's the back? Sit check. Okay. Yes. Yeah, the combination is that can you combine radius and hyaluronic acid? The company will tell you no, but I will tell you yes. Okay? So don't listen to what the company says. Okay, listen to what I said. You could do it. You could do it in the same session if you wanted. Okay, it's completely fine. If you're using a filler, an HA filler that's reputable, that's good, has a good safety track record, you're fine. But if you're using something that's أي كلام, لا هذه مشكلة بقى. Okay? Be careful in that sense. Yes. There is no major dangerous area. The only dangerous area is the infraorbital foramen. Okay? And it's not really a dangerous area. It's that you just don't want to inject that area because it causes too much pain. Yeah. Wait, huh? Alright, very good. Okay, so I'm going to move to the other patient because we're running out of time. Okay, so we've got another maybe 10 minutes. So I'm going to make it interfere with the a mammogram in the future. Okay, so it's not because it's a bad product or it's not good for the breast, but it can interfere with the mammogram. Okay, so I would not inject anything in the breast right now. Okay.
So what about varicose?
For the breast? Yeah, no. You see, don't inject anything for the breast because you don't know how it will look like in the mammogram unless you get a baseline mammogram before and then you can inject her, theoretically.
But still it's a hyaluronic acid.
It's a hyaluronic acid, but you see, a lot of these hyaluronic acids, you don't know what they have all the time because you might develop biofilms, you might develop granulomas. Okay, so it's very important to kind of get a baseline first. Because say for example, you injected the breast. Okay? 2 years later, the filler could be there. Even though they say it's 1 year, it could still be there. I mean, some fillers can last a little bit longer. It depends on how the body takes it. So it can be there. She goes and does a mammogram, okay, and they find something. She's probably have a mastectomy, okay, to try to figure out exactly what's going on. Because the filler is still there, they will see it.
So the message is to do this mammogram first at the base and then do it?
Exactly. If you want to do that first, and then you can inject it. Or basically not to inject it first. I stopped injecting the breast. Okay. Alright, we're going to use the Restylane. Okay. Alright, so we're going to start off. I'm going to do the lips for this patient over here. She's got, if you look at her, she's a very, very good looking young lady. She's 24 years old. Can't believe I am 24? 23? Oh my God. Means I'm 11 years older than her. I feel old now. Okay. So what we're going to try to do is that usually patients like this, they're very good looking. They don't need anything for their face. But what we're going to do here for her is that if you look at her lip, if you look at her lips, what we're going to try to do is that we're just going to contour it. We're not going to create volume. She's the perfect person in which contour is going to help. Okay? We're not going to create major volume. Okay? We're just going to contour it, and you're going to see that this hair area basically going to lift up very nicely. Okay? And we only have, 2 minutes to finish. السريع. She's clean, صح?
Yes.
Relax. Okay. Alright, so this is the, when it comes to the lips, it's a very simple procedure. Usually, like I said, I usually have ice here, but since we don't have ice, it's completely fine. We're going to make do without it. It's fine. عفيتك؟ مش عايزين خلاص. أنا الحمد لما بروح تيجي خلصنا. سرعة turbo. Okay. So pull up on the lips. Visualize your vermilion. Okay? And then you're going to go straight into the vermilion. That's it. خلاص. You're okay. No, you can see. Now it's. Do you see the needle? Yeah, come closer. بس ما تقدرش يجي. You can see it. They can see it. There you go. Okay, can you guys see it? Okay, good. Now relax. Sorry. Okay. So I did not inject anything yet. So I'm going to inject right now, and you can see it fill up as I start injecting. Do you guys see it fill up? I don't know if it's projecting, but.
So you are in the red or
Yes, you're right on the vermilion. Huh?
you are in the red or not the white?
Yes, yeah.
Is this for contouring?
This is for contouring. I'm only going to do contouring for her. She doesn't need it. I don't want her to look like Nancy Agron. See, wait for 2 seconds or 2 minutes, okay? The other, now that you felt the first part, give her time for the lidocaine to have an effect, and she's not going to feel the other. I don't believe in ice to ice. See, she did not feel it go in this time because of the lidocaine. I said, and as I'm injecting, you can see it fill up. Now, after you're done with this vermilion, always switch sides, and you want to inject a little bit of the medial aspect to create that Cupid's bow.
patient in the left side of the legs and ممكن أكمل ولا لازم أعمل النجف كمان؟
No, yes, usually all the way. I'm going to ask you to sit up, and I'm going to ask you to see the right side compared to the left side of the upper part. Very minimal, very small, okay? And we use a very small amount. We use about this is very small. We use about 0.2 throughout the whole vermilion. Okay, very, very small amount. But we're still not done yet. Relax. I'm going to do the exact same thing as I did with the other patient, a little bit on the lateral side. You might feel this one. Remember, she is young, so the quantity that she's going to need is much less compared to the other patient that we had earlier. So after you're done with the vermilion, you want to inject just a little bit on top of it because you don't want it to have that step-off approach. You know, it'll look fake, so you want to make it softer as it comes down. So you inject a very small amount just on the lateral side, so that the cutaneous part of the lip goes along very nicely with the vermilion part. There's no step-off. This way, no one will know that she's had her lips done. No one at all. Sit up. Alright, are you guys seeing that? Look at the corners. Look how the corner has lifted. It's already lifted on one side, but this one on the right, which was treated right over here, it's lifted even higher compared to the other side. Okay? Very good. Any questions? No? لا دي عند الشمعات.
ما انا لسه مراية صغيرة. بصي في عشان هي حاجة شمعات بس بيها.
حسب كده. Usually patients will feel a little numb. And I told her, she's very lovely. I told her, like, inshallah, after doing the lips, هنطلع برا ونقرا فاتحة. فيعني مش عارفة تضحك. All right, we're going to continue. Unless, for the lips, yeah. For the lips. The lips is nice. Any questions? No questions?
What are the precautions to avoid inversions of the lips?
The precautions, use the correct filler, one thing.
Yeah.
Okay, don't inject something very thick. Okay? Inject always the vermilion first and then see if you need anything else. Inject a little bit on the deeper side. يعني مش عاوزة product يكلكع. Okay, inject it on the deeper side. Massage. Massage is very important. If you don't massage immediately, then the product is going to bead like the core. So you don't want that to happen. And inject very small amounts. I mean, we inject like 0.5 right now. the upper lip should be smaller or bigger than the lower lip?
Smaller.
Very good. Okay, so remember that. If you make the upper lip bigger, then the patient is going to look unnatural, and she'll look that she's had something done. Okay, so you want to try to avoid doing that. Okay? So, what I usually tend to do is that I do the vermilion here, but for the lower, I will add volume. I will not do the vermilion for the lower, because you don't need to shape the lower. The lower is mainly made for volume. Okay? لا ما تقوليش خلاص لا هتقعدي she wants to leave. Okay. Alright, so we've injected a total of 0.5 throughout the whole vermilion, okay, including the corners of her mouth. Okay? Now I'm going to do the lower part of her lips. The lower part of the lips it's very, very simple. I ask you to open your mouth just a little bit. Make sure. Okay? Go to the wet, dry area. Go inside, and put in a small amount. I usually inject about 0.1 in this area, then it come out. Then I massage it. Always massage it, because if you don't massage it, it's going to start forming, it's going to, it's going to form these little balls. She's going to feel it. Now the whole point is, she's probably going to feel some material that's under. But that doesn't mean that it's bad. It's normal. It's bad if she starts seeing the material outside. But if it's underneath, if she puts her tongue or if she feels it with her teeth, this is normal. Okay, so don't be worried if a patient comes to you saying, oh, I can feel something inside. That's normal. We've injected something. You're supposed to feel something inside.
I can do the margin for the lower lip.
You could do that, but you don't need to, because the lower lip is not shape. The shape is mainly on the upper. Okay, the lower is volume, so there's more volume for the lower. Now, you will notice how I injected the lower lips. I injected on the lateral side. Do not inject the medial side of the lip, the middle. Okay? You're going to create a sausage by doing that. The lower lip, so what I did, I injected here, and I injected here. It's like a dumbbell. Okay, like in the gym. So we injected just one here and one over there. Don't inject this. You want to create that little depression. Everybody has this normal depression. If you inject here, then you'll have one lip. It looks like a sausage. Okay, you don't want that to happen. Remember, the way that the lips are is that the lower lips have two protrusions here. These are the dumbbells, and a depression here. The upper lip is the opposite. Has the depression here and the protrusion merely in the philtrum. Okay? So the philtrum has to rest on something that's depressed. If you fill this up, she's going to look like a duck. Okay? So you don't want that to happen. Alright, do you guys see her? See her lips? You need to clean her up. I need to see. Alright, very good. Good. Alright. Do you guys see how the lips are made? So what basically happened is that we added volume here, and just the vermilion here. But see, even with just the vermilion, you can see that her upper lips kind of filled up nicely. Okay? So in normal circumstances, okay, what you could do also is that this area is going to swell up. We've added a little bit of volume at the end, just on the sides here, to fill this area up. And that's basically it. You don't need to add anything more for her. She's going to swell up for about maybe 2 days, and then it's just going to go away completely. Any question when it comes to lips? The philtrum? Yeah, we did not do her philtral ridges or anything. Yeah, because she's too young. Yeah, we do it. But I leave a small amount to create that, the philtral ridges. Yeah, you have to keep that little small amount.
So what about the non-touch technique and sterility? I'm worried about this. Sterility and non-touch technique for prevention of infections.
Yeah, so prevention of infection. The things that you have to understand is that we're not doing a sterile technique, we're doing a clean technique. So being clean is important, but it doesn't have to be completely sterile. You could use, in my practice we use alcohol to clean, but you have to make sure that you have to clean your patient completely. She was clean. Yeah, we cleaned her. But you can either use alcohol just to clean her face, or at the same time you can also use chlorhexidine or Hibiclens just to also clean up the area too.
Teeth brush and nose wash.
Oh no. Because I'm not injecting inside, I'm injecting mainly on the outside, so there's no major problems there.
So post procedure.
Yeah.
Would you advise this?
To brush?
Wash?
No.
Antibiotics?
Antibiotics? No. But I do not recommend giving antibiotics unless you're injecting too much. If you're injecting too much, we're talking about macrolide for the body, then maybe antibiotics. But for the face, no need. No need. Yes?
How about the movements? Okay to normalize the eating? Everything is okay?
Yeah, well, she's feeling a little numb right now because of the lidocaine, so I will tell her not to drink hot coffee, okay, for the first maybe hour and a half, 2 hours. But yeah, she's fine. I mean, if you do it to a married woman, then her husband is not going to know. If you do it in the right way.
I mean, it's okay?
Yeah, of course. Well, it depends on what do you mean it's okay? If her husband is a biter, then this is a problem. Okay, but then, but if normally you will not feel it, so it's completely fine.
The cheek also is okay for sleeping?
So usually for the cheeks, I would tell my patients at least the first day, maybe the second day, to try to sleep on their back. Some people tell me it's very hard, so if they are going to sleep on the side, let them sleep on a very soft pillow. Okay, these pillows that doesn't make you have to sleep on, don't sleep on the mattress or a thin pillow. Make your pillow thick, very soft. Okay, so let them sleep on that area, but it should be fine. Yeah, it doesn't migrate usually. Yeah. Dangerous areas in the lips. Okay, the major parts of the lips in which you have to be afraid of, there are 3 things that you want to be afraid of. Is that you want to be afraid of the superior labial and the inferior labial. Usually they run with the muscle underneath very deep. So the chances of you hitting them is very, very low because you're quite superficial when you're injecting. So you won't cause any major problems. If you do hit them, then it's mainly bleeding that happens and they might end up with a bruise. But that goes away with time. Okay? A few?
About leg augmentation.
Leg? Yeah, I don't have any pictures, but I have injected in the legs. You mean the calves here? Yeah, you can put macrolide. You can put macrolide there. Yeah, I've done it, and it looks. I mean, it's interesting what patients want, but yeah, I mean, if they want it, yeah, put macrolide in there. It's completely fine. Very, very safe. Yeah. Any other questions? No? All right, great. Well, thank you so much for coming. And now I'm going to try to treat my other. Yes. Yeah, the normal lip. I mentioned this. Normal lips. Okay, there's the 2 lateral sides are larger. The medial side should be depressed. Should be a little depressed. No, if you make it like this, it looks like a sausage. It doesn't look natural. Yeah, it doesn't look natural. If you today go home Okay, open a magazine. مجلة الموعد. Okay, الموعد. أي مجلة. Okay, وشوف يعني الناس اللي يعني من هوليوود ولا من usually their lips are يعني models. They're filled from the sides but not in the middle.
Like Ilham Shaheen, she make here some balloon here. How? This area
I don't know Ilham Shaheen. أنا عارفة لك ما أعرف من اللي حاقنها يعني.
Some people make some swelling on the lateral
On the lateral side, yeah.
Here. Only how?
How do you by injecting this area?
But in what direction?
What direction? It's the same.
Lower than lower.
Yeah, so if we're talking about the upper lip, right?
What?
The upper or the lower lip?
Upper
lip. Okay. So it's the same thing. You inject not the vermilion. You inject underneath the vermilion on the lip itself. Okay, and that's what you inject. Yeah, you put a very small amount, very very small amount there. Okay, you're welcome. Yes.
I see the duration after 2 weeks when the eye center is under correction. Can I have another session after 2 weeks?
Yes.
Or delay?
No. After 2 weeks, you can have the other session. Yeah, don't delay.
Any type of drug we use or
If you're using, for example, Restylane and the patient is undercorrected, you come back in 2 weeks and it's still undercorrected. Yes, open another Restylane and use it. This is one trick that I want everybody to know this trick. Because if you tell your patients, a lot of your patients will come to you and say, Doctor, how many syringes do I need? Okay? Always tell them you need more than they actually need. If you tell them you need one, and then you inject them, they come back in 2 weeks and they need another one, they will tell you, Doctor, you told me I need only one. What happened? How come I'm using two? And if you're telling me two, I'm not going to pay for the second one.